I am academician since maybe the last 5 years. I don't join any academician institution, so excuse me, I will use that and circulate. So good morning everyone, my name is Anas Naufel. The picture is different, so this is my first time wearing a suit after 3 years. I hope it's good, huh? Good, great. So it is morning in my country, still it is 6 a.m. So if I feel sleepy or my tune is sleepy, bear with me please. I want to do an exercise, let us say morning exercise, before I start my presentation. It will not take, how many hours guys I have? Okay, so I will be saying for you to touch something of your body, okay? And at the same time, I will touch also in my hand some of my body. And I want you to follow my hand, not my voice. What do you think? Yeah. The winner will be gifted by Suhaib, not me. Good? Shall we start? By the way, my glasses only reach to this line, third line. So anyone cheat behind, I cannot see. So touch your nose, touch your head, touch your cheek, touch your mouth. Oh, you are out. I said mouth. Okay, so we continue. Because I said mouth, right? Yeah. But I bought on my ear, so you are out. My hand. Yeah, follow what you watch, not only what you hear. You have done a great study, you know, but I don't know this 14 question, how you ask the people. You know, maybe you ask me, you ask Suhaib, Suhaib very rich person, but maybe he benchmark with Beckham. So he considered himself very poor compared to Beckham. Now I know if it is validated tools means, you know, the question is valid, but I want to say that the message not to continue the exercise. We need to listen, but we need to watch as well. Okay? And the issue we have as academician or decision making, how many times we sit with the patient? We sit them face to face, or even a video call to discuss what their needs. This will be, I like to do study, I am researcher, PhD in public health, this is about research, but also we want to hear the patient voice. And technically I don't run now any presentation, I don't like presentation actually, I run what we call a snack and panelist discussion. Who moderate the panel and who asks the question is patient. And this is how we need to hear patient more and more and watch them what their challenge. With no further delay, I am Anas Naufel. I am from a company called Axios. Axios is an international company. We have been specialized for the last 27 years now in access. And in all my session, because our colleague here, she said equitable access. So who could define access for me? Because always we have challenged to define access. He will give gift. Huh? He has a lot of dates. He carried 25 kilo dates from Dubai and they catch him in the airport thinking he's trading dates. Huh?
Access is ability to get to somewhere.
Okay, so let us say access in healthcare, because we are talking here about healthcare.
Access to good quality doctors, access to healthcare system equipment.
Good, so if we have a great doctor, and me as a patient, I'm able to reach this doctor, and he tell me, God forbidden, but he tell this person, you have a cancer, means we have access, right? No, I disagree. He will be like CNN giving me bad news only. This is part of that. But it's not everything. Try. Try. She said part of that. Access is that you reach high quality of care.
When we need it, where?
When needed,
Okay.
Access includes physical, emotional, mental well-being, when you need it, where you need it, how you need it.
Perfect. Shall we say high quality of care, not only high qualified physician? It addresses all that. So high quality of care, it addresses all that. When you say when they need it, means at the right time, at the right place. If we have East Malaysia, they are underserved in a way or another, because I hear that a lot the last 2 days. That means there is also some action should be taken there. Because this patient, maybe it is diagnosed as CML in Sabah to travel to KL, or this is not the right place. If he travel, means it is not the right place. He should get their treatment in their region. In customize, we are in the customization, you know. This morning, because I don't wear suits since long time, and this seem I get weight, it was not customized for me. Even now, I not feel comfortable. Usually, I am more joyful when I do presentation. So, you know, the customization is very important, and in a sustainable way. This is what happened with the private insurance, the premium insurance. They give you, they give you a premium for 1 year, 18 months, depend on the country. Then they say, nice to meet you, because they want to make money. So sustainability, it is very important in all what we give. And this is a big spectrum when we say sustainability, because it is financial sustainability, it is equality sustainability. Imagine we have a great physician, but we have limited age. This physician will not stay forever. So means he needs to build the capability of his own team or her own team. So we have other 10, 15 great physicians as well. So going back to Axios, Axios is a healthcare consulting company specialized in access, in specific related to financial toxicity, and specific related to treatment. So Axios since 1997 greatly served more than 10 million patients all over the globe to support them in non-affordable treatment. So when we have a treatment where it is high cost, it is a new innovation, Axios were able to support them, as we have seen call for action that we need everyone to come together. This is what we do, you know. We bring everyone on the table to be able to overcome that. In Malaysia, there is a new announcement, will happen inshallah today, where it's talking about also how we overcome the challenge related to affordability for high cost medication. And there's an announcement that we will start supporting patients by a new idea, which is microfinancing. So we need also innovation. 8 months back, I have initiated a new initiative. I don't want you to donate money, even I am a professional beggar. You know, if I sit beside you now, I will let you donate your watch. So, but what we have done, we said donate idea, because sometimes ideas will have more great impact than money. And I will tell you a simple story, then I will start my presentation. In a country very close to us, you know, we have only one oncology center serve the whole population. So people need to travel to get treatment. International organization donate for them 7 million, saying for them do navigation for cancer patient, survivor patient, or patient who are just diagnosed. So telling me I have 10 hours left. Okay, sir. So what happened? In this 7 million, they recruit army of nurses to navigate patient. He's telling the patient, you go from Dr. Suhaib clinic to the pharmacist, then from the pharmacist to radiography. And they are like, these nurses currently, they are transportation vehicle only. 7 million after 2 years, disappear, unfortunately. On the other hand, and this is, I watch it, I don't hear it. When you walk around the hospital, you will see some people sleeping beside the hospital. This is the people coming from rural area, and they have chemo session, and they cannot afford the transportation. They need to sleep beside the hospital. There is no hostel. They cannot afford the high-cost hotel. And they spend 7 million in just a person to say, go there, go there. Who can tell me an idea and donate an idea for these people where it let them spend the 7 million over maybe 10 years, $7 million by the way, huh? And almost 25 million ringgit. Who can donate for me an idea? You have it in each hospital. I don't know, I don't visit hospital yet here. Better than this army of nurses. Any idea? Very nice date, juicy date. Just harvest, you know. It is very fresh. If Access fire me, I could sell date in this case. Both lines, sticker on the ground saying pharmacy, and here is this will cost you $20. Because this is what the nurse was doing. And this is about donate idea. I encourage all of you, if you have any idea, there is no silly idea. I encourage all of you to donate idea. You could do this initiative here just on Twitter or Instagram. Donate an idea for cancer patient. And there is no silly idea. And the best idea you have, it is the one coming from patient. The one coming from patient, it's the best idea, because always when we think out of the box, but always we miss the experience part, the exposure and patient they have it. When we are talking about we think, I cannot hold myself not asking this question, and I will start my presentation, I promise you. Can you tell me how you could put elephant in the fridge? Huh? Chaman, she is a killer, she's saying cut it. Yeah, repeat.
Open the fridge. Bring in the elephant.
Huh? That's it. All the other, it is your assumption, negative vibe. So I will start my presentation now. As I said, I am from Axios. Axios have been thriving to sort the accessibility issue. We have served 10 million all over the country. In Africa, we born in Africa for the HIV, the antiretroviral, if we have medical background. I will be talking about the survivorship and the ecosystem for survivorship. And since 2012, I have a challenge, how I could identify the unmet need. Financial toxicity, it is for everyone. And by the way, patients, they are humans. Patients, they are humans, so usually we miss that really if this patient, as a human, what are their needs? And again, I always have issue with objectivity versus subjectivity. And going with the validation, one of my PhD, it is about validation. and how we could validate tools. You tell me that's 5 minutes more, so I need to be very fast. So this is about Axios. I am not here to sell Axios. We have a lot of publication, and I want to go directly. This is very nice slide, by the way, where it's talking about the patient journey. So imagine a survivor. A survivor means they have go through all this step. Who could count these boxes? There are 36 boxes. Imagine you go to the trip to UK, where you stop over by Australia, then by Indonesia, then by Oman, after Oman by Dubai, then from Dubai to Kenya, from Kenya to France, then you go to UK. Or direct flight to UK. Our patient, they go through all this from disease awareness, and they are now here. They are continuing the treatment, if there's treatment, or they are cancer-free, they don't need treatment. But still, it is very long journey. And we need to take that in consideration when we are discussing with cancer survivor. Here is what I found, and this is the first and last time I have seen something in WHO was beneficial for me. It is the 5-dimensional approach. So I read a report in WHO saying that patient needs, in general, it's a 5-dimensional approach. Socio-economic needs, healthcare system dimension, disease-related dimension. She's a cancer survivor for a breast cancer. Maybe she need cosmetic. She need wellness clinic. She. So we need to look to the disease as well. Therapy-related dimension. And last but not least, which is the patient-related dimension. All initiative, nationally or regionally or globally, they focus on patient-related dimension. And we have done a study where we ask patients, CML chronic myeloid leukemia, one of the leukemia, but patients survive for a long time, and now hopefully they get remission after 2 years, where they don't need education about their disease. They know the disease better than hematologist himself. They don't need even the PCR test. They know how to get it in very affordable way. They want someone to find for them job. Only that. Because of that, we know that now there is national program in some country to enforce employer, especially private industry, to have cancer survivor as part of their group. So the 5-dimensional need, this is a WHO report. It is not me, I have done nothing in that. And they have sub-factor for each need. The question always I have, how I could convert that to a questionnaire to ask the patient. Why I want to do this? I want to build customized plan, support plan for each patient. I want to ensure that when I provide service for the patient, it is customized based on their current need. And I don't want to miss anything. And I will tell you, in United Arab Emirates, we conduct a study with multiple sclerosis patients. This is out of cancer. It is a chronic disease, hit mainly healthy women, and they are young, they could be 20, 21. And we ask them about the need. And always I think that spiritual, I have 1 minute only. I think that spiritual, it has a huge impact on people, especially on patients. And in the study, we figure out that no, they want just to spend more time with their healthcare professional. So my assumption because my sister has this disease, for the last 15 years was wrong. And maybe I were pushing my sister for that, where this is not what her need. And that's what I mean by customization. So we read the WHO report. I read it maybe 20 times. And the question always, how I could make that to action. Here is where is Axios. Axios, not only theoretical part. We partner with academicians to be able to implement something on the ground, to sort out issue. I don't put on my slide call for action.
Call for action.
You need to remove the mask. Anyway, I will finish. So what we have done, we create something called BNAT. BNAT, it is Patient Need Assessment Tools. NHS, they have created a tool as well in 1996 called BNAT as well. But our tool, it is I don't want to say any brand of car, but very luxury sport car with lazy horse. This is the BNAT of NHS. It is very advanced, our tools, and it have algorithm to first identify what are the patient need based on this 5 dimension, but also has the algorithm to tell you what are the most effective interaction or intervention you have to do with these patients. So our lovely team all over the globe, they call the patient, they ask this question. It is validated tools. There's 3 publications about BNAT, and the 4th is coming now. And it tell you, they ask these couple of questions, and they customize what we call patient support adherence plan. And adherence means to cope with their current situation. And we succeed with many case studies. I don't want to talk about the case study. See, there is a lot of slides my team they bought usually. But no, I want, maybe they remove it. But these are some of the services where we provide, So we provide the psychological issues, definitely the financial toxicity, we work with them on that. So we find for them job. We help them to afford their treatment by microfinancing, 0 interest. We have very nice model. We have very creative, innovative model when it comes to patient. And we do personalized educational session, and this will be my last 30 seconds, I promise. Everything should be personalized, customized. You cannot just throw education material and say to the patient, take it. And I will end by story, because always I'm a storyteller. We have a patient, we tell her that you have this disease. And she's married. I called her after maybe 13 months. And she said, I will call you later. 2 minutes later, but it seems she go out or something. I told her, wait, why you go out? You are where? I am at home, but I go out. Why? I don't tell my husband that I have cancer. So we need to educate her how to tell her husband. But at the second day, we need to tell her husband about the disease. And I asked her why. She said, because I am afraid that he will think all his kids will have the same disease. So this is what I mean by personalized education. Because of that, now we have material called caregiver education material. It's how we educate the husband, the wife, the father, the mother. I know a lot of mothers, they are controlling their children and their children care plan. Not because they hate their children, but not always it is right what they do. No, didn't take that. This is chemical. And it has been prescribed by a professor who spent 30 years studying abroad. Personalization, customization, this is what BNAT do. And this is again what access to healthcare means. And the most important part, not to forget, you see how poor men, they are not empowered. And they suffer more financial toxicity. Because we empower women. And again, we need to empower women more and more. I have 7 sisters, So we are a long family, but I have 7 sisters, so I used to empower people. And all the office we have here in Malaysia, we have only 2 poor men. And the rest, they are women. So empowering women, it is very important, especially in providing health care, because they control everything. My wife, she bought everything for me. And even that, my lovely wife, but now she is maybe still sleeping. She has a presentation too today for breast cancer patient. Thank you for listening for me. Unfortunately, this gentleman, he seems very assertive. You select the right person to sit in front of the speakers to do that. Thank you, and thank you all.
Thank you, Dr. Anas, for such a great presentation. By the way, I think we are okay to see you. You can do our discussion. No worries. All right. I think we open the floor for question and answer session. If you have a very burning question to our three speakers, I think we can have our first questions.
If they don't ask me, ask them.
That's okay. I think my voice is loud enough. Good morning, everyone. Thank you for the presentations. My question is to Dr. Anas. I think it's really great what you guys are doing, especially the patient needs assessment tool. Very often we never ask patients what they need, and we assume this is what they need. So yesterday, I'm from Roche, we had our talk on partnerships for funding. And one of the patients, caregiver of a patient, told us, in Malaysia, we have the B40 group, the M40 and T20. The government does a lot of things for the B40. The T20 kind of takes care of itself, and the M40 is kind of neglected. I like your idea on your plan on microfinancing. In a regulated country like Malaysia, how does this microfinancing work for groups like M40 who really need that kind of financial support for high cost of treatment? Thank you.
I don't know, maybe they bought the size of this chair for Malaysian, not for my body. First of all, we already announced in the World Cancer Day in NCSM initiative in Feb about having international funds, okay? And you will not see such high commitment that we are coming now in June and we are announcing the initiative to start. So we are starting by July. So it is very well regulated because it is in the presence of minister. So I will not do that if there is anything under table to make such publicity. How it works, it is microfinance by say, but it is also patient assistance program. So what technically we do, there is some patient who could pay maybe for 50% of their treatment out of 100%. The issue that they delay their treatment because they need to collect the money. Second, if they go to bank, most probably bank, you know the issue of banks, I hope there is no banker here, but banks give loans for rich people. They don't give loans for poor people. This is the issue. Or even middle class people, because you're talking about the middle class. So our objective is, kind of we are giving loans, we give advance money, patient to pay it over time as installment, we call it flexible installment plan, with the following 3 rules. First, 0 interest rate. This is not what Access do, you know, Access doing patient support program. Again, this will be implemented with National Cancer Society of Malaysia, which is NCSM, who host this event as well, and they are our partner. So, means as regulation-wise, we have studied from legal compliance point of view. I know Roche, sometimes your compliance, they are very strict, but it is very regulated, you know. And the most important part, where banks, they don't do, if patients deviate from paying because they lose their job or anything happened to them, we will not sue them. We will not put their names in the airport so they catch them in the airport. We will elevate that. Why? This money is coming from the international fund, which is charitable fund. So technically, we are trying to expand the beneficiary. So M40, I know that B40 they are doing for them a lot, but M40 they will be as well the most people who will benefit from this service, which we call it microfinancing. Actually, we don't use this term. I believe it is very commercial, very banking. So we use other term in Axios called on-time access, because they delayed to take their treatment, they could not start because of cash flow, because of affordability. So this is what we do. I took 1 minute more.